I am the Director of Ambulatory Operations for here at the Gallipolis location. I'm going to talk to you today about our drug-free workplace program. This is a program we started in 2007 prior to our merger. We did this because we were not having a drug problem. We had a workers' compensation cost problem, and we had to find ways in which to reduce our workers' compensation costs as the clinic. The program has been so successful and has been so strong throughout the state, but not only with us throughout the state, that we actually, when we merged, we have kept the program and we've just made it a little bit more robust and to move on. Again, if you have questions as we go through this, please feel free to ask questions or anything. Anyway, everybody here understand how your workers' compensation cost is configured, right? The drive that's based off your payroll and the number of lost time accidents. And what's really important to this is to understand what a lost time accident is. A lost time accident is anyone that is off work for 8 consecutive days. So it's 8 calendar days. It's not 8 working days, it's 8 calendar days. If you're off work starting at 8th day, we have to consider you a lost time accident. So therefore, we have to start accruing money through the state to pay you in case you can't come back to work. So that drives our premiums up to make for those accruals to do that. So day 7, if you're not back to work, there's a good chance the person that you report to is trying to figure out how to get you back into a light duty position or something like that, just to get you back to work so we can get you off of the lost time accident, and that's the reason for that. So we'll talk about reasons that we implement the drug-free workplace program all the way through the conversation. We'll talk about the essentials of the policy. Folks, the policy is 14.5 pages long. If you get a chance, sit down and read it, look over, peruse it. It's to your advantage to know what's in the policy. Type of drug testing that we will do, and we'll talk about disease models of alcohol and other drug addictions. We'll talk about signs and symptoms, safety concerns, and about information for community resources. In other words, if you know someone or you or they don't have to be an employee here, but anyone that may need help for drug or alcohol problems, there's resources that will be available, and you'll see those at the end, and that are available for anybody. Here's what I don't want to do. I don't want to qualify anybody to be somebody's expert. I don't want you to be somebody's counselor, their intervention specialist, or anything along those lines. But what we hope is that you may recognize some things that somebody does have a drug or alcohol problem and may need help. A little stat here, we'll talk about reasons for implementing it. Americans make up 6% of the population. So we're a very, very small part of the world. We're only 6% of it. Okay? But we consume over 60% of all the illegal drugs in the world. So we have a big appetite for those type of things like this. Obviously, we do this for safety as a top concern. We got a number of claims on workers' comp, as we talked about earlier, drove up our cost, and you see our most common instances listed there are slips, trips, falls, strains, and sprains. Benefits of the program. Obviously, a stable work environment, more productive work environment, better employee morale, better decision making, better security. But that last one, better organizational image and community relations. Folks, here's one thing I'll stress to this. Everybody in this room touches patient care somehow, some way, every day, every time. So it's important that people know out in the community that we do take this very seriously. We have the avenues in which to test, and that we do test people, and we can do anything that we need to, and that we spend a lot of time and money hiring and training people. And we get the best people that are here to get them here and to have them come here. So it's very important that people understand that, and I think it's important that people know we have that out in the organization and in the community. We'll clearly state why the program is being implemented. It applies to all employees. Go get our org chart. Start at the very top, go all the way down to the bottom. No one is exempt from this, and that includes the physicians and providers. We'll talk about behaviors that are prohibited, an explanation for violating the policy, and consequences for refusing to be tested. Why would you refuse to be tested? Think you're guilty? There's nowhere in our policy that says if you're guilty or if it comes up dirty that we have to fire you. Okay? If you refuse to be tested, you are terminated. So take the test. You have nothing to lose. You could be the greatest employee we have, and you make one bad decision, and that bad decision leads to this and leads to that, and you get drug tested, and it comes back. And you could be, as I said, the best employee. We want to keep you. We want to do everything. As long as everybody's in agreement, you got to go, and you have to get help. And you get up to 12 weeks to get that help. You come back. You're certified to come back. You sign a second chance agreement on the day you return. And it says for 1 year, and this is the only time you will hear this term, we can randomly drug test you for 1 year. your supervisor, your vice president, your director, your manager, whatever, they could drug test you every day if that's what they chose to do. Now, that's to the extreme, but I use that to make the point, right? But you're going to get drug tested 4 times a year. You're going to get drug tested every quarter while you're on that, right? It's the only time you'll ever see a random. You make it through that 1 year, you're good to go. There's no problem. If you should fail any of the tests during that 1 year, you're done. There is no third strike, so you get 2 and you're done. 2 chances, and you're out. There's also something called disclosure. And disclosure is very simply this. I have a drug or alcohol problem, and I go to my manager, my boss, I go to HR, I go to a close friend in the organization, and I say, I have a drug or alcohol problem, and I need help. They cannot get rid of me. They have to give me the opportunity to go get help, come back and sign the second chance agreement. Now understand the difference between me voluntarily stepping forward and them walking me down the hallway to have my drug test done, and I said, you know, I think I got a drug or alcohol problem. They have me at that point. I'm happy. All right? They've already got it. I have to voluntarily, in other words, there's nothing that makes me step out other than I voluntarily step out and say, I have a drug or alcohol problem. Make sense? Okay. Do that. Confidentiality. Guys, your results of this test are kept in a single file cabinet, or a separate file cabinet, let me say it that way, in a separate file cabinet in a locked room under a lock and key. One person in HR has a key to that file cabinet, and you better have a very good reason for wanting in that file cabinet if you want to know about someone's drug result. By policy, this doesn't go in your personnel file, and this doesn't go into your medical record file. It is kept in a separate policy, or a separate file. What constitutes a positive test? What are the testing procedures? We'll talk about occasions. Supervisors take a little extra training, and obviously we're communicating the program to you prior to you starting. Type of testing, we do pre-employment, post-accident, reasonable suspicion. Pre-employment is just what it says it is. It's a pre-employment physical. I started here in 1994. I did a pre-employment drug screen. Okay? So it's the same thing. All of you had to take that. Congratulations, all of you passed. Post-accident is just what it says it is. It's a post-accident drug screen. If I should get hurt on Holzer's time or Holzer's property, and I seek medical attention, so in other words, I leave here and I walk outside and I trip and fall walking somewhere, and I get up and my wrist is going in 3 different directions, I'm probably going to go seek medical attention. I'm going to go see a doctor and find out what's wrong. I'm going to get drug tested for that. If I walk outside and I trip and fall and put my hand down and catch myself and scrape my hand, and I walk over to urgent care or walk into the back part of the ER and say I need a Band-Aid or something, wipe it out, put a Band-Aid on it, that's first aid. That's totally different, so I will not be drug tested. Understand the difference between the two and what drives that, right? And the third one is reasonable suspicion. What it says is we have reason to suspect that you're under the influence of drugs or alcohol. So if you leave every day at lunch and you come back, and you're walking down the hallways, and it takes you 10 minutes to walk 5 feet, and you're bouncing off each side of the halls, and you're laughing about it, and you think it's funny, you're probably going to get drug tested, okay? And when you get drug tested for reasonable suspicion, you can no longer work. You're off work until that result comes back. You also, we cannot allow you to drive home if you're being being tested under reasonable suspicion. We will either allow you to call someone to come and get you, or we will offer to take you home to do that. Think about it. We can't say, here's the keys to a 4,000-pound missile and send you down the road. We think you're under the influence of drugs or alcohol. Right? Now, if you leave and go over here to the bank, turn around, come back and get your car and go, that's on you. We did our job. You chose to come back and get your car. It takes about 2.5 days, depending on what time of the day the drug test is collected. But before you get it back, if it's clean, you got no problems. If there's something in it, then you got to figure out what's going on and what the next steps will be. You can see here, no random testing with the exception, one exception. And that's if you're on the second chance agreement. And you'll also see 13-panel urine tests, and you see everything that we test over there. And we also do a breathalyzer. And the breathalyzer is nothing different than if you've had the misfortune of being stopped by one of the state's, county, or city's finest, and they've asked you to take a test. You blow in the machine, and it converts your breath to a blood alcohol percentage. And if your blood alcohol percentage hits 0.08%, congratulations, you are legally intoxicated in the state of Ohio. Right? you can see that our threshold is much stricter. It's 0.02%. By policy with the state, we could have had a zero tolerance. It could have been zero. All the way up to 0.04%. Believe it or not, that's the DOT standard right there. The federal DOT standard is 0.02%. So we wanted to find out why. We went and checked it. And the main reason before that is because they said there are medications and mouthwashes out there that have alcohol in them. It is non-ethanol alcohol, but it is still alcohol, and it will register on a breathalyzer. Now, if you test positive, or if you test and you test at 0.025, you have to sit there for 15 minutes and you have to watch this little hourglass tick off, and then when you're done, you blow into the machine again and it'll register. If it's non-ethanol alcohol, it'll probably be under the 0.02%, or at least dropping really fast. If it's ethanol alcohol, probably will not have moved, if any, very little at that point. Why do people use drugs or alcohol? Feel accepted, to feel better, lift their spirits, calm and quiet their nerves, stress, or to alter reality. Job stress, how things change at work. You have change in job duty. You have a problem with a coworker. You may have a problem with communication between you and a manager, job interfering at home, or you have an injury that you keep hurting or re-injuring, and it causes you to have stress from that. Warning signs of dependency. This talks about drinking, refers to alcohol or to drugs as well. You keep drinking and taking the drugs, you get the same effect. So in other words, my tolerance gets higher and higher and higher. So if I go out and have a drink tonight, I may have one or two, and you get that little feeling that you get. But I keep going out, so now I have to have 3 or 4 to get to that feeling. 5 or 6, 7 or 8. You get the point. You just keep building a tolerance up, and it takes more and more to get there. Blackout. I lose some part of my day. I take enough drugs or I drink enough alcohol that it causes me to lose part of my day. It could be something as simple as where I parked my car, to where I had lunch, to who I talked to what we talked about, or whatever the case may be. Personality changes, they become moody, irritable. Denial, you don't believe there's a problem. In other words, I think I can stop, or I know I can stop whenever I want to, but I just choose not to. So I'm in denial of the problem, even though I know deep down that's how I function. Quick little stats here. Drugs in the workplace, 70% of illicit drug users are employed, 85% of heavy alcohol users are employed, 60% workers are someone who uses drugs at work, and 60% of cocaine users report buying or selling drugs at work. I thought those were very high numbers. But we checked with another 2 or 3 other places, and those numbers are within 2 or 3 percentage points of everywhere we checked. So they're very accurate. Alcohol, what is it? Chemical called ethanol. Basically, here's 4 things alcohol will do for you. It'll make you 10 feet tall and bulletproof. It will affect your cognitive thinking. It will affect your balance and coordination, and it will break down your immune system over a long period of time. And that is what we do. Over a period of time, you have liver, heart, brain damage. Signs and symptoms of use, you see all of those listed there. We'll talk about change in peer group associations here shortly. And absenteeism. Anybody know what's the most missed day of the week? It is Monday. It used to be Friday, they changed to Monday. Substance abusers use 3 to 400% more health benefits than the average individual. Who cares, right? It's not you. Everybody understand how your health care benefits are factored in? How the payment of those comes up? If we're all on Holzer's health care, I'm going out every night and getting smashed, and I come in and I'm going to the ER 2 or 3 nights out of the week, thank you for helping pay my health care costs, because I'm utilizing our health care, I'm driving our cost up. That cost is shared amongst the group in the Holzer health care plan. So you guys are all helping to pay for my cost for me going out and doing that. So it does drive health care costs. 2/3 of hospital admissions are alcohol related. Men are more likely to become alcoholics than women, and it can shorten your life by 10 years. Don't be fooled. A 12-ounce beer, a 4-ounce glass of wine, and a shot of 80-proof liquor have about the same amount of alcohol in them. Folks, it's taking about 30 minutes to get into your system. There is no way to speed up the metabolism of alcohol out of your system. I will tell my age, anybody ever heard the old adage, eat bread? It absorbs the alcohol out of your stomach before it gets into your bloodstream and all this and that. That doesn't work, okay? It'll just make you fat, all right? Take a cold shower, it'll help wake you up. You're still going to be drunk, you're just going to be clean and cold, all right? Drink coffee, doesn't help. Drink water, doesn't help. You cannot speed up the metabolism of alcohol out of your system. And it takes it per drink about an hour to get out of your system, on average, per person. Some a little faster, some a little slower, but on average, about an hour. Half of all fatalities involve a driver with alcohol in his or her system. There's about 12,000 deaths attributed to that each year. The progression of alcohol, social drinking. So you start out, you go out once or twice a day, or once or twice a day, my God, once or twice a week, and something, and you have a drink or two. So you just go out with friends or whatever, have a little social drink. Then all of a sudden you start going out more and more often. You remember we talked about that increased tolerance. So my tolerance level gets higher and higher. I'm drinking more and more, and I finally get to the point where I can't stop until I just get completely smashed. Intoxicated, inebriated, pick your term. Right? Significant change in behavior toward family and friends. Folks, here's the big thing. How many people go out somewhere and you see somebody and they're in a group of people and they don't really think, you're not real sure how that group all goes together? There's probably the one person that you don't think, or two people that you think don't belong in that group. They're probably in that group because that group's going out drinking and that's what they want to do. As an example, this group here may go out tonight, so I'm their new best friends. I'm going out with them because I want to go out and drink and do that, so they're going, so I'm going with them tonight. Don't care what we're going to do, but you're doing what I want to do, so I want to go do that. But tomorrow, they're not going to be any fun. They're going to be good at the Book of the Month Club, right? But that group back there is going to go out. So I'm going to go with them. I'm always changing my peer groups and my associations to meet what I want, to help me do that. And if you see people doing that, there's a good chance there is a drug or alcohol problem involved in that. Obviously, you'll be completely dependent, and you're always thinking about the next drink. I'm thinking, you know, it's a certain time here in 6 hours I can go get another drink. I'm planning my day. I'm planning on it, thinking about it, wanting to get there. So if you have someone doing that, you know there may be a problem. Jack worked for Pepsi. He tested positive for Coke, so Pepsi fired Jack. Prescription medication. 2/3 of working Americans use prescription medication illegally. 60% sell to other people or to other employees. Folks, here's the deal. If I'm going home tonight and I slip and fall and get hurt or whatever, or I go home and have a bad headache, and somebody in my family, my wife, somebody has a medication for a headache, and I take it because it helps, and I feel really good, and I get up tomorrow morning and then I'm going to have a really bad day. Got a lot of stuff on my plate, got the headaches back, so I take the medication again because it helped. And I walk in, I fall down and get hurt, seek medical attention, I'm getting drug tested. And when I get drug tested, that medicine is going to show up in my, medication is going to show up in my drug stream. So then I have to show the medical review officer the prescription for that. Well, I don't have a prescription for that, so therefore I'm a positive drug test. All right? Change that whole scenario, and now I am, it is my prescription, but it says take one every 4 hours as needed for pain. But you know what? I just told you it's going to be a really bad day tomorrow. And I know that, so I get up in the morning and I take 2. Fall down, get hurt, go to, they want to see my prescription. I have it. My prescription, but I got more of the drug in my system than my prescription calls for because I took 2 pills instead of 1 in that 4-hour period. So therefore, by the drug-free workplace program, I am a positive drug test. Right? Take the test. Right? Always take the test. OxyContin it's very addictive. It'll dull your senses. They snort it, chew it, take over. The rush lasts about 15 minutes, but the drug itself will stay in your body about 5 hours. Drug testing is a big part today, and that's one of the reasons we're involved in doing this as the state. If you want to do any kind of work for the state of Ohio, you have to be part of the drug-free workplace program. Drug categories you see listed there: stimulants, depressants, and hallucinogens, and each type of drug that falls underneath those categories. Cannabis, or marijuana, it's a mixture of flowering leaves, tops, stems, seeds, of cannabis plant. THC is the active ingredient. Anybody want to venture a guess as to how much the THC was in marijuana in the 60s and early 70s? 3%. 3%. Anybody want to guess what it is today? A little high, but that's close. 62. 62. So, marijuana is still a gateway drug. Everybody understand what we mean by gateway drug? It's still a gateway drug, but marijuana is highly addictive. Marijuana has become highly addictive now. It is a dangerous drug, but it is a gateway drug that is everywhere. Marijuana will have a lot of the same effects as alcohol. 10 feet tall and bulletproof. It will make you affect your cognitive thinking. It will affect your coordination, and it will eventually break down your immune system. You can smoke it, eat it, chew it, brew it. It's a 3rd grade visit to the ER. You see how it can make you feel, long-term effects, and you see signs of abuse they're listed there. Marijuana remains detectable in your body a lot longer than other drugs. Casual use of marijuana can be up to 2 weeks. If you use it once or twice a week, it can stay in your body from the last time up to 2 weeks or a little longer. If you use marijuana on a chronic basis, it can be in your body for a number of months before it completely gets out to do this, depending on how long. You cannot fail a urine drug test using the drug-free workplace detection levels as a result of casual exposure. So in other words, if I go out tonight with everybody and somebody, we're going out to celebrate everybody's new job, and somebody fires one up, and I get tested the next day and test positive, I can't say, oh, it was that person sitting beside me in the car, it wasn't me. No, I was partaking in the act. So, there. Little study of marijuana. They put 3 airline pilots in simulators. They flew them into airports all under the same conditions. They averaged 12 feet off center of the runway. Very good by aviation standards. They gave them marijuana, put them back into planes 20, back up. Put them back into planes 12 hours later. They averaged 28 feet off center of the runway. Not very good by aviation standards. They send them to a hotel. Come back. Now it's 24 hours later. Same scenario. They're still averaged 24 feet off center of the runways. Not very good by aviation standards. So marijuana does have a longer lasting effect. Safety and addiction, again, will produce decreased reaction time, memory lapses, and loss of judgment, all which likely can increase the likelihood of dangerous errors. And again, folks, remember what we said. Everybody in here touches patient care in some direction every day, every time. Cocaine is basically it'll make your heartbeat increase, spasms, blood vessels, heart failure, permanent nerve damage, respiratory failure. They put it in sodas in the 1880s and 1900s. It was called Coca-Cola or dope soda. They stopped doing it in the 1920s. Right? Some people say it led to the depressions of the 30s. I don't know. Safety of cocaine, lapse of attention due to intoxication, sleep deprivation. People that get addicted or on cocaine, they'll go on cocaine for days. 2 or 3 days at a time, and they don't sleep, they don't rest, they don't do anything. They just keep taking cocaine. So eventually their body starts to shut down, and they have to recover. And that may take them a day or so to recover. Basically, they just sleep, they just have to recover. And then after they do that, they start right back on it because of the addiction. And their body does it again, and it's up and down, all through that. They become paranoid, aggressive, have mood swings, highly correlated workplace death, and it's the largest contributor to death, suicide, and homicide in the U.S. today still. Ecstasy is a club drug, synthetic or man-made, taken orally, and basically, folks, it'll fry your brain with heat. It'll get your body temperature so high, the blood in your body, the temperature is so high that when it gets that temperature of 108, 109 degrees starts running through your brain can't handle that. So it starts shutting down and it goes into a coma, on down, because it's trying to protect itself, so eventually into death. Inhalants are chemicals that give off fumes. A guy that teaches this class that I take this from talked about a school system in Cincinnati real quickly that outlawed the scrunchies or crunchies that girls wear in their hair because they were dipping them in different types of paint thinners and diesel fuel and all this and that, and they were wearing them on their wrist during class, and then they would sit there and sniffle to do that, so to do all that. So it's just different things along those lines. They may use paint thinner, you may use glue, whatever the case may be. Meth, #1 drug problem in the U.S. It is the poor man's cocaine. It is also being rivaled today with another drug. Anybody have any idea what that is? Heroin. It is heroin. Heroin is everywhere, and unfortunately, it seems to just keep coming up. You see things that you use to make meth with Drano, brake fluid, battery acid, rubbing alcohol, fertilizer. Sudafed, by the way, you are allowed to take. Okay, you take that directly, and engine starting fluid. All the rest of those you really can't. They're not for human consumption. But all of that goes into making meth. And they put it, and they add heat to it, and they cook it up, and supposedly cook off the impurities. And then they cook it one other time to make sure it's ready. Once they get it to that point, meth is ready to be sold. Meth is 99% addictive on first-time use. Right? If you want to take a really quick shot at it, maybe at lunch today, you try a glass of Drano. See how that may work. 1 in every 6 meth labs blows up. Well, if you have somebody high on drugs, you got about 1,700 degrees of heat, and you have engine starting fluid and things along those lines with flash points, there's a good chance something can blow up and go boom pretty quick. You create 6 pounds of toxic waste for every pound of meth. If you own a piece of property and somebody is running a meth lab in it, I would like to congratulate you. You now own a toxic waste site. You cannot abandon those sites if the government finds out about them. You can't go in and put a little paint on them and maybe new carpet, things along those lines. The government will literally send in a team in the white outfits, the masks, the whole 9 yards, and they will strip it down, and you'll be lucky if you have a shell left when they're done. Your homeowner's insurance will not pay for that, your renter's insurance does not pay for that, and your taxes do not. You, as a property owner, will get a bill roughly for about $80,000. Right? Average life expectancy is about 5 years. You see 4 ways in which they use it: inject it, smoke it, snort it, take it orally. In 2005, you had 500 meth labs busted in Ohio, 17,000 in the U.S. 80% of them had children in them at the time they were busted. And children for this was kids basically 12 and under, so it was preteens, and it is what classified for that. Lady at the top, she's been on meth for 3 years. The guy at the bottom for 3 months. Impact of substance abuse in the workplace. You talk about employee health, productivity, decision-making, safety, employee morale. Again, folks, I want to go back to that organizational limit to community relation. That is really an important thing. It's very important for the organization because we want people to know how seriously we take everything that we do and how important it is to us as an organization. If you want to go for treatment in Cincinnati area, you can go there. This area there. The Dayton, Ohio, there. Cleveland. And in Southern Ohio, which is our areas here, and you can see all the places that are listed there that you can contact if you should have drug or alcohol. And that's pretty much it.